President Trump signing an executive order to significantly reduce drug prices, bringing transparency and competition to prescription drug markets, putting American patients first. The president ordering the Medicare drug pricing negotiation program to increase savings while saying patients should pay the same price that hospitals pay for drugs. He also is promising to provide massive discounts to low-income patients for life-saving medications. Joining me now is National Institutes of Health Director, Dr. Jay Bhattacharya. Director, thanks so much for being here this morning.
Thanks for having me.
Tell us exactly what the president wants to do and what you see as the impact this year.
So it's an all-of-the-above approach, emphasizing market competition, so to bring competition into the market much more easily to existing drugs, to use the power that Medicare has over negotiations with to reduce the price that so that Medicare pays the same price that hospitals get for drugs, cutting drug prices by a substantial amount. Also to get drugs, the essential medicines like insulin and epinephrine in the hands of low-income patients at pennies on the dollar. It's a really important advance to make sure that Americans have access to drugs at an affordable price, and I really applaud President Trump for doing this. It's a big step forward.
But, Dr. Bhattacharya, I mean, how do you actually do it when all of these middlemen, quote-unquote middlemen, are in the system, right? I mean, you've got the pharmacy benefit managers, you've got the doctors, the hospitals. Everybody wants a piece of it. And isn't that the reason that prices are so high?
I mean, that's a good point, Maria. The thing is, the executive order addresses that, too. I think the first step with that is transparency, to understand exactly the markups that these PBMs, these pharmacy benefit managers, and these middlemen play. It's really hard to get any accurate information about that. This executive order essentially makes it so that those prices and those transactions are going to be open to the public so we can see what's going on. I mean, drug pricing is a very complicated thing. There are a lot of moving parts. What President Trump has done is he's allowed Secretary Kennedy and Health and Human Services to start really opening up the can so you can look inside, and also using the tools that are already there on the shelf. So, for instance, reducing the price of insulin by for poor patients is something that actually was sitting there on the shelf, but the government never did it before. With President Trump's executive order, poor patients are going to have access to insulin at pennies on the dollar. It's a huge advance forward, in my view. This is something that's been a problem in health policy for a long time, and President Trump's order really addresses it squarely.
This is a really important order because people are getting killed by these prices. And I know during your Senate testimony, you vowed to establish a culture of respect for free speech and scientific dissent. You promised to vigorously regulate risky research that has the possibility of causing a pandemic. What can you tell us about that and your priorities now at the agency?
Maria, that is really important to me. The idea that we can have a culture where authority determines what's true and false in science is the very antithesis of science. Unfortunately, during the pandemic, the Biden administration used its power to essentially silence and suppress the voices of countless numbers of scientists who, on social media and other settings. I want to change that, and President Trump wants to change that. Secretary Kennedy wants to change that. What has to happen is that if there are dissenting scientific views, people who disagree with me, they should have the say. And we should be encouraging a culture where scientists can talk to each other without fear of reprisals, without fear of suppression, and without fear of censorship. That is going to be a major priority of mine to use the sort of the influence of the NIH to make that happen. Thank you.
But by the way, there's also a China element here, right? They've been stealing our intellectual property on science.
They have, actually, and that's another major advance I think we'll see in coming days. A lot of the investments that we've made in through the NIH have correctly involved international cooperation with ally nations and others. But given the geopolitical situation, we're going to have to take a close look to make sure that the intellectual property that the NIH develops really benefits Americans most.
That's right. That's a great point. Dr. Bhattacharya, I hope you'll come back soon. We need more time to dig further into this. We so appreciate your time and your leadership here, sir. Thank you.